Did you know a panicked rabbit can kick hard enough to literally snap its own spine? Crazy, right? Well, welcome to this explainer. Today, we're diving straight into a life-or-death reality in rabbit care, preventing catastrophic spinal injuries through proper housing and handling. If you manage a boarding facility or you're just super invested in rabbit welfare, you already know these guys aren't low-maintenance guests. But today, we're going to break down the exact biological, environmental, and operational protocols you need to keep them safe.
Okay. So here's our roadmap for today, as we shift from thinking of rabbits as just easy caged pets to really understanding their need for a strict safety framework. We're going to cover 1. The anatomy of a crisis, 2. Hidden risks of boarding, 3. Setting the housing standard, 4. Mastering safe handling, and 5. Professional oversight.
Let's jump right into Section 1, Anatomy of a Crisis.
We're dealing with a really dangerous anatomical combo here. You've got these incredibly powerful hind legs paired with a surprisingly delicate, brittle spine. That's the reality of their biology, and when mishandled, it is an absolute recipe for disaster. Just one sudden kick or a panic twist can cause catastrophic vertebral fractures.
And that single panicked twist is driven by a flight reflex. It can lead to irreversible nerve damage, prolonged suffering, or even euthanasia. It's not like the rabbit is making a conscious choice here. It's a split-second, totally involuntary survival reaction. When they feel confined or improperly restrained, that reflex kicks in, and the sheer force of those back legs can literally snap their spine.
Moving on to Section 2, Hidden Risks of Boarding.
Since they're prey animals, their startle factor is just off the charts. They have this near panoramic vision, but ironically, there's a huge blind spot right in front of their nose. Combine that blind spot with an extreme sensitivity to sudden sounds and movements, and, well, they are constantly primed to bolt. Even really subtle changes in scent, sound, or the routine in a boarding facility can trigger acute distress.
Now, historically, the way we've housed them has been completely backwards. Traditional, cramped touches deny them natural movement, which skyrockets their chronic stress and risk of injury. Plus, wire-bottom floors cause incredibly painful sore hocks, and being stuck in that cramped space puts constant strain on that fragile spine we were just talking about.
So how do we fix this? Let's look at Section 3, Setting the Housing Standard.
Walk-in aviaries or converted sheds are absolutely the new baseline to prevent those panic responses. We're talking a minimum space requirement of 3 by 2 by 1 meters. This gives them the room to actually move, stretch, and express natural behaviors safely. And this is crucial. Solid flooring covered with fleece, rugs, or straw matting is non-negotiable. It totally eliminates the pain and stress of wire mesh floors, which drastically reduces the chances of a sudden, injury-inducing panic.
The difference between a stressed rabbit and a secure one is literally night and day. Seeing a joyful mid-air binky, that happy little twist and kick, proves a rabbit feels safe, and only adequate space makes that possible. On the flip side, tight spaces and a lack of enrichment just provoke anxiety. Keeping their environment predictable and giving them tunnels and hideouts to simulate burrows gives them a sense of security and really cuts down on fear-driven behavior.
Let's dive into Section 4, Mastering Safe Handling. We really need to ask a vital question here to debunk one of the most dangerous myths in rabbit care. Is a still rabbit on its back actually relaxed? The answer is a massive, definitive no. Tonic immobility, which is commonly called trancing, is not relaxation. It's actually a fear-induced paralysis response. Honestly, trancing should never be used. Putting a rabbit on its back might seem like a convenient way to keep them still, but that animal is experiencing extreme, potentially fatal terror. This state is directly linked to GI stasis, a deadly digestive shutdown, and in severe cases, actual cardiac arrest. Because of these extreme physical reactions, you should never, ever use trancing for routine care, exams, or demonstrations. It literally needs to be banned from your practice. And similarly, you absolutely must forbid lifting any rabbit by its ears or scruff. Both of these outdated methods cause acute pain, sheer panic, and significantly elevate the risk of a spinal injury. Look, when handling is absolutely necessary, all interactions have to be supervised by a trained adult. Ground-level interaction is key. Minimize lifting entirely. Just sit on the floor and let the rabbit approach you. But if you must restrain them, supporting the hindquarters is the single most critical step to prevent a spine-breaking kick. If a rabbit feels its back legs dangling, its instinct is to kick out, creating that exact twisting force that snaps the spine. Always move slowly, be deliberate, and keep totally calm to communicate safety.
Finally, let's wrap up with Section 5, Professional Oversight.
The 4-pillar boarding audit is basically your must-have checklist for accountability. It covers clinical observation for daily checks on appetite and posture, rescuer-grade sanitation for rigorous disinfection, emergency readiness so your staff can immediately spot signs of GI stasis or spinal trauma, and full transparency, meaning you give owners honest, detailed briefings on routines and health concerns.
Your staff really has to build what we call emergency intuition. Because rabbits are prey animals, they instinctively hide when they're in pain or sick. So by the time you actually see symptoms, it's usually critical. That means your team needs to know that subtle changes, like a missed meal, fewer droppings, a hunched posture, or even just a reluctance to move, mean they are rapidly deteriorating. You need prompt vet intervention. Delays are literally fatal. And remember, complex diagnostics are for a qualified vet to handle, not a boarding carer.
There's a quote from the source material that just hits the nail on the head. A rabbit's safety depends entirely on our ability to respect their nature, not our convenience. Rabbits are highly intelligent, deeply fragile animals, and taking care of them requires deliberate, constant vigilance. Every choice you make about housing, handling, and staffing matters immensely.
So I'm going to leave you with this final challenge. Every single time you handle or house a rabbit, you're making a life or death decision about their safety. Will you audit your boarding space today against these guidelines? Make ground-level interaction your absolute baseline policy. Prioritize non-invasive handling and invest in real veterinary partnerships. Let's honor their trust with the highest standard of practice, because in this line of work, convenience can quite literally be lethal.